Kenya is one of the 32 countries of the IDF African region. About 425 million people have diabetes in this world, and more than 16 million people in African region. By 2045, it will be around 41 million. There were about 500,000 cases of diabetes in Kenya in 2018. This is just a representation in the third world countries. What about the first world countries? In United States, approximately 20 million people are affected or afflicted, and each year, some 900,000 new cases are diagnosed. A large percentage have the disease, but they don't know yet. So the prevalence of diabetes is so high. Treatment for diabetes is made more difficult because a person can have the disease a long time before it is diagnosed. Because the early symptoms are relatively mild, diabetes often goes unrecognized. Hence, diabetes has been dubbed the silent killer, a disease of the young. Diabetes is becoming a disease of the young. The average age for the onset of diabetes is indeed dropping. 18 years ago, medical students were taught that diabetes couldn't occur in people under 40. Now we are seeing it in people under 10. Why the increase in diabetes among the youth? Sometimes a genetic predisposition is involved, but weight and environment may also play a role. The number of obese children has doubled in the past 2 decades. What accounts for this? There have been a number of changes in food habits and activity patterns over the last 25 years. These include increased reliance on food consumed outside the home, increased rates of skipping breakfast, increased consumption of soft drinks and fast foods, reduction of physical education in schools, and elimination of recess in schools. Diabetes cannot be reversed. Therefore, it is wise to follow the advice of one teenager sufferer who simply states, stay away from junk foods and stay fit. Why serious? Diabetes has been called a disorder of the very engine of life, and for a good reason. When the body cannot metabolize glucose, a number of vital mechanisms can break down, sometimes with life-threatening consequences. People don't die directly from diabetes. They die from complications. A good job is done in preventing the complications, but a poor job in treating them once they occur. Is there hope for those afflicted with diabetes? Yes, if they recognize the seriousness of the disorder and submit to a program of treatment. Diet and exercise. Although diabetes type 1 cannot be prevented, scientists are studying the genetic risk factors and are trying to find ways to suppress an immune attack. With type 2 diabetes, the picture is much brighter. Says the book Diabetes, Caring for Your Emotions as Well as Your Health. Many of those who might be genetically susceptible avoid showing any signs of this disease simply by eating a balanced diet and exercising regularly, thereby staying physically fit and keeping their weight within normal limits. Underscoring the value of exercise, the Journal of the American Medical Association reported on a large study involving women. The study found that a single bout of physical activity increases insulin-mediated glucose uptake by the body cell for more than 24 hours. Hence, the report concludes that both walking and vigorous activity are associated with substantial reduction in risk of type 2 diabetes in women. The researcher recommends at least 30 minutes of a moderate physical activity on most, if not all, days of the week. This can include sometimes as simple as walking. Is probably the best, safest, and the least expensive form of exercise. However, exercise by people with diabetes should be professional and supervised. One reason is that diabetes can damage the vascular system and even the nerves, thus affecting blood circulation and feeling. Hence, a simple scratch on the foot may go unnoticed, get infected and turn into an ulcer, a serious condition that may lead to amputation if not treated immediately. Still, an exercise regimen can help one to manage diabetes. The more researchers study the benefits of regular exercise, the better the news they get. The insulin therapy. Many with diabetes must supplement their diet and exercise program with daily testing of glucose levels, along with multiple insulin injections. As a result of improved health through diet and good routine of exercise, some with type 2 diabetes have been able, for at least for a time, to discontinue insulin therapy. If insulin is needed, however, there is no reason for the patient to feel discouraged. Going on insulin does not imply failure on your part. Whatever form of diabetes you have, if you carefully control your blood sugar, you will minimize other health problems later or complications. In fact, a recent study revealed that people with type 1 who kept strict control of their blood sugar levels had a drastic reduction in occurrence of diabetic eye, kidney and nerve disease. The risk of eye disease called retinopathy, for instance, was cut by 76%. Those with type 2 who kept tight control of their blood sugar levels enjoy similar benefits. To make insulin therapy easier and less traumatic, syringes and insulin pens, the most tools used, are microfine needles that give minimal discomfort. The first shot is usually the worst. After that, most patients say they hardly feel anything. Other methods of injection include automatic injections that shoot a needle into the skin painlessly, jet injections that literally fire insulin through the skin by means of fine jet blast, and infusers that employ a catheter that stays in place for 2 or 3 days. About the size of a pocket pager, the insulin pump has gained popularity. This programmable device dispenses insulin through a catheter at a steady rate according to the body's daily needs, making insulin administration more precise and convenient. Keep learning. All told, there is no blanket therapy for diabetes. When considering treatment, each individual must take into account a number of factors in order to make personal decisions. Even though you may be under the care of a medical team, you are in the driver's seat. Medical treatment of diabetes without systemic self-management education can be regarded as substandard and unethical care. The more those with diabetes learn about the disease, the better equipped they will be to manage their health and increase their prospect of living longer and healthier life. Effective education, however, calls for patience. If you try to learn everything at once, you are likely to get confused and not use the information effectively. Besides, much of the most useful information you will need to learn isn't found in the books or pamphlets. It has to do with how your blood sugar varies with changes in routine. This can only be learned over time through trial and error. For example, by careful monitoring, you learn how your body reacts to stress, which can cause your blood sugar level to shoot up. The role of glucose. Glucose fuels the body's trillion of cells. To enter the cells, however, it needs a key, which is insulin, a chemical released by the pancreas. With type 1 diabetes, insulin is simply not available. With type 2, the body makes insulin, but usually not enough. Moreover, the cells are reluctant to let insulin in, a condition called insulin resistance. Both forms of diabetes, the result is the same. Hungry cells are dangerous levels of sugars in the blood. In type 1 diabetes, a person's immune system attacks the insulin-producing beta cells in the pancreas. Hence, type 1 diabetes is an autoimmune disease and is sometimes called immune-mediated diabetes. Factors that can trigger an immune reaction include viruses, toxic chemicals, and certain drugs. Genetic makeup may also be implicated, for type 1 diabetes often runs in families and is the most common in Caucasians. With type 2 diabetes, the genetic factor is even stronger, but with a greater occurrence among non-Caucasians. Australians, Aborigines, and Native Americans are among the most affected, the latter having the highest rate of type 2 diabetes in the world. Researchers are studying the relationship between genetics and obesity, as well as the way excess fat seems to promote insulin resistance in genetically susceptible people, unlike type 1 diabetes. Type 2 diabetes occurs in those who are over 40 years of age. About the size of a banana, the pancreas lies just behind the stomach. The healthy pancreas performs a continuous and exquisite balancing act, managing to sustain smooth, stable blood sugar levels by releasing just the right amount of insulin as glucose levels wax and wane throughout the day. Beta cells within the pancreas are the source of the hormone insulin. When beta cells fail to produce enough insulin, glucose builds up in the blood, causing hyperglycemia. The opposite, low blood sugar, is called hypoglycemia. In concert with the pancreas, the liver helps to manage blood sugar levels by storing excess glucose in a form called glycogen. When combined by the pancreas, the liver converts glycogen back into glucose for use in the body. Role of sugar. There is a common misconception that eating a lot of sugar causes diabetes. Medical evidence shows that getting fat, regardless of sugar intake, increases the risk among genetically susceptible individuals. Still, eating too much sugar is unhealthy, since it provides poor nutrition and contributes to obesity. Another misconception is that people with diabetes have an abnormal craving for sugar. In reality, though they have the same desire for sweets as most others, when it is not controlled, diabetes can lead to hunger, but not necessarily for sugar. People with diabetes can eat sweets, but they must factor their sugar intake into their overall diet plan. Recent studies have shown that a diet high in fructose, sugar derived from fruits and vegetables, can contribute to insulin resistance and even diabetes in animals, regardless of their weight. Thank you.